Hey, everybody, welcome to this episode of Compassion and Courage Conversations in Healthcare. This is the podcast where I teach compassionate communication, provide perspective, and inspire resilience. I'm Marcus Engel. I'm a professional speaker and author, and I get to bring you all kinds of healthcare thought leaders, faculty, practitioners, etc., from across the spectrum of healthcare to try to bring a little bit more compassion and courage into your life. And today I'm really excited to introduce to you my two friends, Jill and Rachel. Thank you guys so much for being on with me and welcome to the show. More than me introducing you, could I ask you all to introduce yourselves to the listening audience?
Sure. I'm Jill Semau. I live in Missouri. I'm the director of the medical assisting program at State Fair Community College.
Awesome.
And
Thank you,
I'm Rachel Clifford. I'm a certified medical assistant. I also live in Missouri, and I am Jill's medical assisting clinical coordinator at State Fair Community College.
Excellent. So for people like me who have zero clinical expertise, what is a medical assistant? Where would a patient usually cross paths with a medical assistant?
We are in clinics. We don't work in hospitals, but we work in clinics and specialty practice, family practice, you name it. If it's in the clinic, a medical assistant is the one who's taking your weight and height and giving you injections, taking your blood, swabbing your throat. We kind of do the nursing job. We're not nurses, but we do the nursing job, but within clinics. Rachel?
Yep. So usually when someone goes to see their family doctor or their cardiologist or another specialist, it's usually a medical assistant who's checking them in, asking them all about their medications and their social history, their surgical history. That's what medical assistants are usually seen for, but we also do administrative tasks like making sure that medication that's not covered by your insurance gets approved by the insurance, or if you need a refill of your medicines, we do that as well. The biggest difference between medical assisting and nursing is medical assistants are not licensed like nurses are, but instead we're certified and credentialed.
Gotcha. And so I go to the doctor and I'm going to not walk straight into the doctor's office and meet straight with the doctor. I'm going to meet a medical assistant first, or maybe a receptionist first. So it's so important for MAs and reception to be that compassionate, caring presence when patients first enter the clinic, when they're nervous and afraid and potentially vulnerable.
Exactly.
Right?
Especially when they first come in. Who wants to be greeted by somebody who has a short temper or is disinterested in the reason why the patient is there? That receptionists sometimes are medical assistants too, but we greet with we're making sure that our patients are really wanted, that we want to see the patient, that you're welcome in the clinic, and that whatever the reason why you're seeing the provider that day is not taking up our time, it's not wasting up our time, but we're actually going to take care of you, and we're going to take care of you the best way that we possibly know how. We're going to give you the best care.
It's beautiful. And I know that you two have used my books with some of your students to help reinforce those ideas too. So thank you for doing that. Have you, can you share a little bit about how you've done that and what your results have been?
So Marcus, I first heard about you 4 or 5 years ago. I actually had a student who worked at a hospital in Jefferson City that had heard you, and she brought her books and said, "You've got to read this." I picked it up and I started reading it while they were in class. And from that moment on, the I'm Here book, our first semester students read it, required reading, and they write discussion posts about what they're learning. I have specific questions each week about the chapters that they've read. for them to answer. They share their stories. They share how they felt going to the doctor, how they want to be when they're a medical assistant. And then our second semester students read your other end of the stethoscope book. They love you. They really do not like reading. They tell us, I just can't stand reading for our assignments. Sad. But then they'll say, but I can't put this book down. And they're like, I know you only assigned 3 chapters, but I finished it, So I love it. I love to know they're reading it and getting something out of it. So we refer back to your book quite a bit. Like, if you want to do these things that they're doing in the book, you need to read your other books too. So it does.
Well, I'm so glad to hear. I'm so glad to hear that they have a positive response to required reading.
Yes.
That's not always the case.
Yeah, I have to slow them down. I'm like, please don't read it all at once. Oh, it's so hard not to. But you teach them so much. I wish you could read their discussion posts. I mean, I cry sometimes. So.
Yeah, because of course I always talk about that there are a few different ways to generate compassion, and some of that is through gratitude practices, and some of that is through naming our things that we're grateful for, but it's also through hearing the stories of others. And when we can hear the stories of others, that's whenever we can start to get more connected with their humanity, right? And what makes them tick and what makes them who they are. I assume that a lot of times MAs are hearing the stories of patients, even though that story might better be told to the doctor or the practitioner who's seeing the patient. But I feel like that brings up such a good opportunity that another way that we can be compassionate is simply through active listening. And if our students are learning how to actively listen to those narratives of patients, perhaps those patients then also feel like they're a little more held, and that their MA and that their care team is going to be a little more engaged with their care.
Exactly. I completely agree. When we have prospective students, high school students who are looking into the medical field, that is one of the things that we kind of engage those students with is, yes, we're going to teach you about how to do vitals and injections and draw blood and all these technical skills. But the other skill that we're going to teach you is you're going to get that 82-year-old man who's been married for the past 50 years. His wife just passed away and he doesn't know what to do. And all that type of patient wants is 2 minutes of them saying whatever is in their heart or on their mind, and for the medical assistant to just sit there, be present, listen, and go, if you ever need anything, Joe, you are always welcome to call here and I will talk to you.
It's reaching out with support, not just
Correct.
medical care. You don't need help, you need support, right? And that's sometimes hard to recognize, but MAs being the receptacles of these stories, that makes me think that there's a lot of potential there for healing when people just need, as you said, a minute or two to share. I've always felt like, ever since being in the narrative medicine program, that individuals, no matter who you are, there is a story inside of you that is clawing to get out, that there is something inside of you that needs to be shared. And we all have this internal desire and drive to hear and be heard. And so I always ask my guests a question, and it's also the same question that my pre-meds at Notre Dame get at the beginning of every semester. And that is to share a story of compassion, share a story about a time that someone has been there for you, or that you have been there for another person. And I'd love to have both of you share today if we have time. So who would like to go first on this prompt?
I'll share first, and then Rachel.
Okay.
I'll give my shorter version.
Sure.
So I actually was in missions for 20 years. That was my first career. And while I was in missions, I learned so much the value of even just helping one person at a time. And that was my goal, just to be there for even one person. And I remember one particular person, I was there. It was in the highlands of Irian Jaya, which is above Australia, New Guinea. And we were in a village, and there was a woman who'd walked the day before miles and miles to come to us. And she was having her baby. Well, we discovered when she got to us that the baby had already passed, and our goal became saving her life. So I sat there and held her hand for hours. She was scared. I didn't speak her language. She didn't speak mine, but we were both women. We understood the horrors of what she was going through. So I held her hand, and then she did pass, her and the baby. It was very, very, very sad. And then my person I was with, we went outside after that, and she just said to me, Jill, I don't know why we had to walk through this with her, and I don't know why or the meaning, but I'm glad we were there with her. Well, fast forward 20 years, I was the one in America now, pregnant with my daughter, who I had been told would not survive birth, and they encouraged me to not have her, to abort her, and I'm like, no, no. But I put my life at risk. So anyway, long story short, when I was in labor with her, they did have to put me under. It was traumatic. She did pass away, and when I woke up, it was like the woman whose hand I held. I was scared. I didn't know what. I mean, you're groggy. You don't know what's going on. I couldn't catch my breath. And there was a nurse next to me who literally held my hand, and she said the same words, Marcus, I'm here. And this is before I knew Marcus, but she said, I'm here. And those words just washed over me like a peace. And okay, I'm not alone. I'm here. And she said, take your time. I will be with you until you're ready, to go see your daughter. And I always remember her just comforting me in those few minutes. And she took the time to do a lot of extra things for me that you don't think to do when you're in a situation like that, like take photos and make sure I got the prints before I left the hospital. I don't know her name, but I remember her. I remember what she looks like. And it was just incredible. So that's my story.
Wow. Well, thank you for sharing that. And of course, pediatric child loss like this is a horrible thing. And you have my sympathy and empathy and love for walking through that. Thank you for that.
That gets me all up in my feels.
And yeah,
Yes.
because we're human, right? Because we're human, and that's what we're supposed to do. We're supposed to have emotions. We're supposed to connect with the stories of others, the difficulties and the suffering of others too, right? What we get to do. That's what we get to do. So, and Rachel, I know you have a story as well.
And fortunately, over the course of the past 12 years, I've been able to take it from talking 45 minutes to like 10, because it is such a large piece of my life that happened. So my husband and I met at 4-H camp when we were teenagers. So that's how long my husband and I knew each other. And we dated, high school, drifted apart. I moved away, got married, started a family. That's a whole different kettle of fish. But eventually I wound up moving back to Missouri, divorcing my first husband and raising my son on my own. And it was by chance that I re-met my husband, my second husband. Again, his name was Austin. And we got married in 2006. And it was amazing. I can still remember everything to this day and how everything smelled. The thing about my husband, though, is Austin was born with spina bifida, which is a congenital defect, birth defect of the spine. It's caused from a lack of iron while the spine is developing in the mother's womb. And that was related to his father, being a Vietnam veteran and being exposed to the chemicals such as Agent Orange. So from the
Wow.
moment he was born, his mother was able to hold him for a few minutes before they took him for his very first surgery. And that was his life. A surgery was needed here to correct that, or surgery was needed here to correct this. And throughout the course of his life, there were physicians who were saying, please expect that your child shouldn't live to see his first birthday. And then it was 5. And then he shouldn't live to be a teenager. He shouldn't live into his 20s. And essentially, every time that he and his family were told that he shouldn't survive past a certain age, my husband said, "Watch me." And he did. He was extremely intelligent. He was homeschooled, got his GED at 16, had a full ride scholarship to Southern Illinois University for wheelchair basketball because he played wheelchair basketball. The Kansas City Museum now has all of his wheelchair basketball uniform and medals. It's part of one of their displays of Kansas City history. The Kansas City Pioneers was the name of the chair or the team. He had a very large surgery when he was a child. He had an infection that removed one of his legs. And then he also, in his mid-20s, had his kidney removed. And I say all of this because there was so much that happened to his body. And then when things really started to happen, there wasn't a lot of research about spina bifida, all of those conditions, and then eventually how he lost his life. So in 2010, he had some weeping from some ischial wounds that he occurred from when he was a child. And so we went to KU Medical Center, had it evaluated, had biopsies, was put on medication, went home on home health. I learned a lot about wound care. And her name was Sherry. She worked for the VNA, which is the Visiting Nurses Association. And I learned so much about wound care from that nurse that I would have never have learned in school. He healed. And then we had an event where he sat for a very long amount of time and those wounds resurfaced. We went back to KU at the end of 2010. And they said, you know what, we're going to do a little bit deeper dive into the reasons why he's having this repetitive infection. So they took bone and tissue and discovered that he had squamous cell carcinoma just below his tailbone, which is interesting where the location of that cancer was, plus his spina bifida, plus all of the surgeries that he had already had in his lifetime. So at first, his surgical oncologist, Dr. Joshua Mauman, who to this day I absolutely adore, said, why don't we start off with radiation treatments after we remove the cancer, and then we'll go from there. So had the cancer removed, had 6 weeks of radiation treatment, and then on February 23rd of 2011, which is my son's birthday, he graduated from radiation treatment. So 6 months later, we go back in. He has a CT scan, and unfortunately, that little piece of cancer decided to grow back in the same space, in the same spot, and the same size. So when we went back to follow up with Dr. Mauman, he had to reach out to his fellow providers at Memorial Sloan Kettering and MD Anderson to try to figure out what do we do for this patient who has spina bifida plus cancer. And I will always thank him, because I don't know of many physicians, no matter what health system they work for, who would have done that for their patient. So they had a consortium about what to do, and then they came up with options, and the options that he was given, he chose the third option, and that was a hemicorporectomy, or a translumbar amputation. So everything from L5, L4, and L3, everything from there was taken off on October 5th of 2011. Their hope was that it would not spread, that they cut essentially like the head off the snake and it shouldn't grow anywhere else. It was a 16-hour operation that included Dr. Maumon, Dr. D'Souza, she is in plastics, Dr. Holtzberlein, who's in urology, and Dr. Ashcraft, who was a general surgeon. And through that 16 hours, my family and I was in a teeny tiny little room, and every 2 hours, almost on the dot, Bucky, the nurse, she was probably about 5'4". She had glasses, and she would just come straight out of the OR. She'd give us the update, and then she'd sit and she'd say, "Now, do you have any questions?" I will never forget Bucky. Never, ever, ever. She was amazing. So through her, we were all able to be a little bit more calm about this huge, massive surgery that Austin was having. Unfortunately, it didn't work. He was inpatient at KU Med. After that, he did great. The physicians did amazing. He never had any infection, no, nothing. He did fantastic. But a week before Thanksgiving of that year, he had some behavioral changes. So the provider said, "Well, why don't we do some labs?" His labs came back elevated. They did a CT scan, and they saw that he had grown new lesions, one in each lung, and there were 3 in his abdomen. So at that time, Dr. Heather Mail, who is a palliative physician, came in and told us there was nothing else that we could do. But before Dr. Mail could come in, Dr. Maumon came in. And physicians are always very busy, go, 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 especially at a teaching hospital. Go, go, go. You have 20 students who are coming in. They're regurgitating the medical chart, what's been happening, what has he been through. And at this point, Dr. Maumon actually came in and he sat down with us. And I'm not crying. There is no crying in healthcare. I'm not going to do it. So I'm just going to say that right now. But he came in and he explained to us what was on the CT scan. And even then, he said, "I'm sorry. Most providers at that level of care don't stop to sit with a patient and their family and express a very sincere sympathy that what they tried to do didn't work. Usually it's, 'I'm sorry it didn't work. Here's another provider, and if you need anything, call my nurse.' But he sat down and he really did explain things to us. And then eventually all of the providers came in and talked to us and wished that the outcome had been different. For his 5 minutes of just stopping and saying that, I will always be grateful, because my husband did come home on hospice, just like his father did earlier that same year in May. We lost his father-in-law to cancer. And then a couple of years later, we lost my mother-in-law. also to cancer. But while we were on hospice, I love those nurses. I wish they still had hospice for the town that I live in, but they don't anymore. But they were very attentive. And when my husband passed away, I think it was 20 minutes, and the hospice nurse was there and helped us do all of the things, didn't rush us, didn't say, you have to do this, you have to do that, none of that. And she was just as amazing. Through that experience, I have learned not to be judgmental towards my patients and whatever experience they are going through. Because you just don't know what people have been through to get to where they are while they're sitting down getting their patient interview for the reason why they're there to see the provider. So if my 2 seconds of my life I can kind of give to them, or they can give me theirs, then being a medical assistant is all worth it. I just really wish I hadn't gone through that kind of experience, but I do appreciate some of the lessons that I learned by going through it.
I'm glad you survived it. That's a lot of loss in a short amount of time and a lot of tragedy before the loss ever occurred.
It is a lot.
It's a lot. It's a lot. But you said that some of the things that you learned through it, and I often talk about with, when there is no answer to that question of why, there is no answer to why, there is always some type of redemption if we learned from the experience. If we take the time to learn from the experience and grow and evolve from said experience, then it wasn't a waste. I would never, and I would imagine you would say the same thing, I would never want to go through what I went through again. However, if I learned something from it, that's the redemption. That's the redemption right there.
I like that term.
Yeah. And I don't use that necessarily in any kind of spiritual or religious sense. It's being able to reclaim an experience for good instead of just letting an experience happen as a natural flow of life. And I'm really grateful for you for sharing that. And again, I'm very sorry that you had to go through that much loss and suffering over the last couple of years. But isn't love worth
Yes.
it?
Yes.
I got
Isn't love
5
worth
years.
it?
I got 5
Right?
years out of him, married, even though we had known each other much longer than that. But we celebrated our 5-year wedding anniversary at KU Medical Center on the 6th floor, 4th floor. That was before I got moved to the 6th floor. On the 4th floor.
And I've seen that redemption in Rachel. Every day I see it with the students. These students have been through some hard stuff too. We get to read about it some when we have them write their discussions on your book, Marcus. And I've watched Rachel with these students. She just gives that extra, listens. She's gentle and caring with them, recognizes, what's going on in their lives, gives them extra homework time if they need it. She has that compassion and care. I think both of us going through things we've gone to, it does make us a whole lot more compassionate and caring than if we had not gone through those times. So.
And your students, I feel, are so fortunate to have your personal experiences that teach them not just academic, not just the textbooks, but that you're bringing in stories and personal experiences and reflection and hearing theirs too, because the stories that many students bring to life are, we're all human, but the stories that students bring sometimes are things that you would hope nobody ever has to experience in their lives. And yet here we are, all survivors,
Exactly.
right? We're surviving. Yeah. So I have a real quick follow-up question for both of you, and you can feel free to steal this if you'd like. But I always ask my guests if you had the ability to have the world's largest billboard on top of the world's tallest mountain, what is the message that you would broadcast to humanity? What do you want humanity to know?
Mine would be that your life makes a difference. No matter how small, we can make a difference in each other's lives. So it would say, your life makes a difference.
Beautiful, beautiful.
That is an excellent question. I like what Jill said. Let's see.
We're fortunate.
The old adage, don't judge a book by its cover. Don't do it. It's one of the things that we teach our students. We'll have, patients come in who are maybe disheveled, they smell. They might not speak very well. Maybe they're immigrants from another country and English isn't their first language. I have worked with healthcare professionals who instantly judge someone who doesn't look or sound like them. And in medical assisting, you can't do that. So definitely don't judge a book by its cover, because once you start reading your patient's stories, then you're like, oh my goodness, I had no idea. And thank you for sharing. I had one gentleman, he was a professional musician, had no idea when he hobbled into the clinic. So don't judge a book by its cover.
Yeah. Wow. I almost think that we can, I'm kind of a simpleton. I like to make things as short and easy as possible. And one of the definitions that we use with my pre-meds for compassion is non-judgmental awareness. Non-judgmental awareness. And so I feel like if we're spending time in judgment, we're stepping out of compassion, and we cannot be compassionate when we're judging someone. Now it just becomes up to us to become more aware of when we do judge and to try to step away from that.
I had
Yeah. So maybe don't judge a book by its cover. It could be knocked down to don't judge.
When I first started out in medical assisting way a long time ago, I had a patient who came in to see us for chronic migraines. And she was a very petite woman, and she always had to get a controlled medicine shot of medication. And the first thing that, a young 20-something-year-old medical assistant is thinking is, oh, they must be drug seeking. They must be. And then when you have other coworkers who are saying, yep, they're drug seeking. It's the only reason why they come in here. But she had something done by the provider. And after that, I'm like, there's no way that she could go through this amount of pain on a weekly basis and just be drug seeking. I learned a lot from that patient just by what she endured.
And if we immediately jump to judgment about another person's pain, and that pain could be physical, emotional, across the board, psychiatric, psychological, whatever that case is, when we jump to judgment of another person, we can't truly be recognizing them in the same humanity that we are, right? We're putting a bridge or a wall up between, I guess we're putting a wall between us, not a bridge between us. I just always, and it's really hard not to judge too, right? Nobody knows how hard it is not to judge until they have to really, really work at not judging. It's very difficult, but it's also extremely important.
Otherwise, you cannot give good care. If you are judging patients based off of socioeconomic status, their age, their skin color, religion, political affiliation, then one, you can't grow as a person. And two, you just cannot give good care. You have to put away that judgment. Otherwise, you also can't give good feedback. Your listening skills are off. So as soon as that judgment gets put on the back table, keep it outside in your car, pick it up after you're done working. But if, as long as you keep that judgment at bay, uh, the patient care experience becomes so much different, and you're able to give better, and it's not as exhausting either.
Mm, mm. Able to give better care that's not only better for the patient, but better for the caregiver, for the
Exactly.
provider. And that seems like that's what we're all trying to work towards. Well, I want to thank both of you, Jill and Rachel, for being with me today. Thank you for sharing, especially such deeply intimate and difficult stories. Um, I learned from both of your narratives, and I'm sure listeners will too. So thank you guys both again for being with me
Thank
today.
you.
Well, thank you, Marcus.
This was great. Thank you so much.
Sure
We're very
thing, sure
honored.
thing. And listeners, thank you for being with us on this episode of Compassion and Courage: Conversations in Healthcare. I'm Marcus Engel, and this is the podcast where I teach compassionate communication, provide perspective, and inspire resilience. Remember, for all your keynote speaking needs, compassion training, books, lectures, etc., please visit marcusengel.com. Thank you all again for being with us on this episode of Compassion and Courage.